I'm Anna Abraham. It gives me immense pleasure to introduce Joy Nugent, the fearless woman who embraced death with love and compassion. She disrupted the tradition and redefined palliative care services. Innovative to consider lifestyle choices for the whole person, giving security and comfort towards end of life. Recipient of Women of Distinction Award from the Asia Pacific Business Council for Women. In 2007, she received the Social Entrepreneur Award for Central Australia from Ernst & Young. In 2008, she was admitted to the Moreton Bay College Hall of Fame in recognition of her community services. She travelled and taught palliative care services around the world. She lived in Malaysia, Canada, US, Europe, and now lives in Adelaide. Mentored by legends living and dead such as Florence Nightingale and Dr. Elizabeth Kubler-Ross, and many more. Of 3 books, she launched her first book, As Good as Goodbyes Get, in October 2015 in US. We also have Christine today with us, who is a writer specializing in travel and wellness. She lives in New York and is with us today in Adelaide to find out more about Joy Nugent and her passion. Enjoy the conversation.
Joy, it's been so wonderful meeting you, learning about your work, and I particularly enjoyed your first book, As Goodbyes Get, and your work in palliative care has really been remarkable, and I gather also this book was launched in New York, but I'm wondering if you could tell me exactly how you started in palliative care originally.
Well, I think my life was really a midlife crisis. I'd been married to the successful orthodontist for 30 years, had 4 adult children, but I was restless and I wanted to go back to nursing, which I had left after being married in London, and I worked in Canada. I'd had a very wealthy experience in nursing, but something was really niggling me, and I went back and did a refresher course at the Royal Adelaide, worked out at a hospice with Mary Potter, and it was at Mary Potter Hospice when the nun said, "Would you like to see someone who's just died?" And I thought, why on earth would I want to see someone who's just died? And I couldn't believe how beautiful it was. They had actually laid this patient who had died beautifully, special bedclothes, her hands, there was no sheet over the face and all those terrible things we see. But her hands were there clutching a rose, and there was a candle by the bedside and chairs around the bed, so that people could sit and say their last goodbyes in this etheric energy. It was just so peaceful. And so I learned so much from my time at Mary Potter Hospice, but I just wanted more people to know about dying at home, really. And again, life gave me the experience of caring for my own mother. And again, that was another experience. I knew nothing about palliative care, but I knew she wanted to be at home in her own home with her own garden and her own sounds, and she wanted the food that she wanted, and that was my biggest gift to her, was to give her a week that was really quite remarkable. So then I thought, well, what am I going to do? Restless, went back to nursing, and then of course I was at Mary Potter Hospice one day, and one of the nuns said to me, "What's wrong with you, Joy?" And I said, "Well, I'm used to being boss." And she said, "Well, you're not going to be." So I thought I could either stay there and be very frustrated or go out and do my own thing. And I went out and set up a nurse practice and called Private Palliative Care Services Proprietary Limited, and made a video and thought it would all just happen. But life is not quite like that. The profession, for example, said, "Who does she think she is? She's only a nurse. Nurses can't do this." And so it was that determination that said, yes, I can, and I'll do it my way. And so I did have a different approach to the way I cared. I cared for people as they wanted to be cared for, not as I, a professional, thought they should be cared for. So I think one of my very first patients, and I write about him in that book, As Goodbyes Get, was dear Mike. And he only had a quarter of a lung. He had cancer of his throat, his lungs, and I was there to tell him about the hospice. And he said, "What hospice? I'm not going to die. I'm not ready to die yet, Joy." And he is still alive today, 30 years later. But in the medical model, he was given a fate. But I wanted him to exercise that lung. And I said, what about a physio being in the medical? Oh, Joy, I don't want a physio. He said, why don't we have a game of golf? You know, so I took him to my golf club, which I was still a member of, and we had a round of golf. But this was the sort of care that I was able to give because it didn't rely on protocols. I could treat people as they wanted to be treated. In my assessment, I would ask them, you know, did they have tea, coffee, 1 sugar, 2 sugars? Did they have wine with the meal? And then they wouldn't have to have that question asked again. I would document it so all the carers that were there knew that they either had alcohol or they didn't have alcohol, or they had tea, or they had coffee, or they liked the blind up when they slept or the blind down when they slept. You know, it was personalised care, which doesn't happen in an institution where it's all of the same and there are, you know, tasks and routines, etc. So that was my style of care. And then I realised that I couldn't do it all myself. So I started to run education courses to educate myself, but also a team of carers. And it was that team of carers that really did all the work. And I maintained the helpline 24 hours a day, 7 days a week. But people knew that I was there. And it's surprising when you give people your mobile phone number and they just know that they don't actually abuse it, you know. But then I remember so many people, as I was getting older and tireder, I'd say, oh, look, you know, don't die during the night, I'm too old. And it was almost as though they knew, you know, they were, you know, and then they started to die at 8 o'clock in the morning, and I'm sure it was because of, you know, not wanting to wake Joy up in the middle of the night, knowing that she would have gone. But that's the sort of thing that I did do, and I think in this economic climate, it was incredibly cost effective because I was the registered nurse, I was the qualified person, I did the initial assessment and got to know how they wanted things done and what they liked and what they didn't like, and the family, what were their needs too, because they're very much part of the care. And so I would do all that and then leave it to others who were less qualified, but just really nice people. In fact, people used to come to me and they'd say, what qualifications do we have to work for you, Joy? And I would say, be a nice, kind, caring person. Because really, I didn't want them learning about lifters and technology if they weren't going to use one. So that we did very much, the care was taught to do what that patient wants, but it could be different for the next one. So there was no standardized care. It was all very individual.
Yes, yeah. From what I understand, your work was very groundbreaking and innovative, you know, right from the start. And you've won a number of awards, one being for an Entrepreneur of the Year. But I wanted to ask you, I gather there were 2 big influences at least, and one was Elizabeth Kubler-Ross and also your time running a hospice in Malaysia and the impact of Buddhism. I'm just wondering if you could tell us a bit more about these impacts.
Well, it's interesting really. I got introduced to Malaysia after I was divorced, and again, this is midlife crisis. What do? You know, do you get up and make your own life, having had 30 years of marriage and etc. And part of that was with the Women Chiefs of Enterprises, of which I was South Australia's first president. There was a conference in Kuala Lumpur, and I went to that conference and met people in Malaysia and ran their first palliative care education in Malaysia. We took up Professor Maddox, who was professor here at the Adelaide University, and another Indian girl, lovely girl from the School of Nursing here, Nirmala Prasari, and we ran the first palliative care course in Malaysia. And then from there, I was a Rotarian at the time, you know, one of those rare women Rotarians, and I set up a matching grant with Malaysia to bring down 30 Malaysians, nurses, doctors and matrons of hospitals to do a training course for a month in Adelaide. And it was from that time in Adelaide that I thought, well, you know, they would have been impressed with all the institutions I'd taken them to. But surprisingly, they were impressed most with what I was doing in my practice, because I was looking at things like personality, soul, Myers-Briggs typology, whether you're an introvert or an extrovert, or an Enneagram, whether you're a bossy 8, or a heartfelt 2. And that was really their interest. So they invited me to go to a little hospice they were wanting to set up in East Malaysia at Dagun. And that was the sort of education they wanted. Yes, they wanted to know about syringe drivers and drugs, etc. But they were very interested in the spiritual component of somebody who was at the end of their life. And of course I learnt about Buddhism, I learnt about Eastern philosophies, and I thought how sensible, because they had a totally different attitude than we do in the West. For example, they wouldn't want pain relief because their pain had some meaning. It was good for their karma. It gave them a next better life. Whereas if I gave education in Australia, it was what drugs do you use and what goes in a syringe driver. But there was very much the emphasis on soul. And so from being a woman chiefs of enterprise person going to a conference, this whole world of Malaysia opened up, and it was 10 years I went there with education to this, and I saw it grow from one room to this big community-based hospice, which I'm very proud to be a patron of.
Oh, that's wonderful. And another thing that really struck me about your work was your four-dimensional aspect to it. Can you just discuss that?
Well, I used to, Elizabeth Kubler-Ross, I went to one of her very early life, death and transition workshops and learnt about people having physical needs, intellectual needs, emotional needs and spiritual needs. But each of those quadrants had to be balanced. Otherwise, I remember at the conference it said it's like a ball, and if it's not balanced, it won't bounce in a straight line. So I would try very hard to look and define when I was teaching or in my practice or doing an assessment, the physical needs, the emotional needs, the intellectual needs, what did they understand, and their spiritual needs. What did they fear? And most people who don't have a religion, often were calmer than people who did have a religion. So it would make me look at what was important and what was it in their beliefs that gave them this strength. And so spiritual needs really became a focus of my care. And I don't mean religious needs, but on the other hand, it was amazing how many people, when I gave them the opportunity to have a priest or a blessing, they would say yes, even if they hadn't been to church for 40, 50 years. So there is still that need to understand what people really need and what they fear at end of life. But I have to tell you about one patient I went to. He was an old panel beater, and his daughter had been caring for him at home, and he just needed some help for the last night, and I met him. I could see he was near death, and I remember giving him a hug and saying, "I'm Joy." And I said, "You're lucky." And he looked at me as though, what on earth's this woman talking about? I said, "You're nearly there. You're about to know what comes next." I said, "I believe there's life after death." And this lovely old panel beater said, "There better be." And that's so wonderful. It was a different thing because, I talked to people who paranormal things were happening. This deathbed phenomena was happening. People were seeing things. Rooms were warm when it should have been cold. I just can't believe how getting up close and personal with somebody who's dying and the family, and when they're doing it at home in their own environment, is such an amazing experience, because you do see these paranormal events and people saw things, and after people died I would go to them in their bereavement period, and they'd say, "Oh, he came to me last night. Oh, what did he say?" It was this messages from the afterlife became very much part of the reassuring that I used to do. But even 30 years ago, I look back now and I think, why didn't I question that? How did I believe that? But I remember looking after an Adelaide man who was a big builder, and he had a Rolls Royce, and we'd taken his Rolls Royce up to his holiday home. He wanted one more journey. But anyway, came back, a long story, we looked after him and he died at home, and a week after he died, I'm in my house, home, we're in bed with 4 children and a husband, and I smell cigarette smoke. And I think, no one in my house smokes. I'll go back to sleep. Next night, same thing, this characteristic cigarette smoke. And I tweaked, I said, okay, Henry, what do you want to tell me? And the thought process, because that's how you're often communicated through in the thought world, or part of the senses, smell, etc. Lots of stories about that too. But I had the thought that came, Joy, be more businesslike, which I was never really good at doing, and look after my granddaughter. Now, you won't believe it, but next day his granddaughter, who was a physio student, came into my office looking for work. And of course I looked after her and gave her work, and she did that for a while. So very much this connection with the afterlife makes and really affirms that we are souls and we travel from lifetime to lifetime. You know, I firmly believe, like Florence Nightingale did and many others, and Eastern philosophies in reincarnation, you know, that we are just passing through. And if you believe that, you don't fear death, which is what it's really all about. But I loved one of my Catholic nun friends who used to say, oh, Joy, death, it's just like a bus terminus. You get off one bus and onto another. and if we do this, but it's so different to the medical approach, where we're bound by this and by that, and I believe people die when they're ready, and that, you know, it's a soul thing. It's not a medical condition. But I also don't fear medications, giving medications to people, because you have to make the body comfortable so that the soul can prepare to die. And the other thing that I find totally amazing is that when somebody does die, the difference between someone who's dead and someone who's alive, there's no energy. And it just reinforces that energy leaves the body. But energy can never be destroyed, it can be transformed. And so I used to like to think that that energy carried the soul particles of this lifetime's experiences with it into wherever it went. And that's where I like this continuation of thinking that life is a continuum, that, you know, we don't just stop and everything, but why the whole world fears death and tries to prevent it at all costs, I just don't understand. You know, to me, to remove the fear. But there are so many books that are written now about the afterlife, and I think that it's just, why isn't it getting into the medical textbooks? You know, we've had Raymond Moody from way back, you know, but it doesn't seem to be taught, it doesn't seem to be considered in the medical model. And I just know that, you know, it just takes away that fear. And so there you are. So that's what I write about in my books.
Yes, and I also understand that you spent 2 to 3 years in the States. In fact, I've met your daughter, who was born in Rochester, New York. So I'm interested in that period. And all 3 books, from As Good as Goodbye Gets, My Way, and Parting the Vow, they're all available in the States as well as
Amazon.
Yes, exactly.
There's nothing
Universally
like
available.
Universally available on Amazon, and they're in Barnes and Noble, I understand, or in their on their online store at the moment, because things aren't open.
Exactly.
But it's true, it's freely available, and the people I meet in my travels from America really enjoy them, and I just hope they can be widely read.
Exactly. That's what we hope also, because from the start your work has been so innovative, so pioneering, and continues to be. And now I understand you have a very interesting healing and meditation gallery in Adelaide.
Well, I do. Here I am at, dare I say, at 81, starting a new business called Hanabaku, which is a healing and meditation gallery. It is run as a for-profit business because it supports another charity that I've just started called Soul Talks, and that is to encourage other health professionals to put soul into their work and consider what I've been talking about.
That's really wonderful, because I think for so many of us, with us all living longer and various ailments setting in earlier, and just, you know, general awareness of health, so many people are so much more interested in this aspect of health. And it's
mindfulness, meditation, it's all about going within.
Exactly, yeah. So you really have a tremendous legacy of work, and Adelaide's been very lucky to have you. But of course, you know, now you're available around the world, so that's very exciting news. And Joy, just to finish up, is there anything in particular you want to add as far as your work? Or?
Well, look, I really think the message of all my work is that if we get death right, we get life right. You know, but when we don't talk about death and it's put in the closet, we don't really live, because it's still there hanging over us. So live every day as though it's your last, and get death right, and we get life right.
Very good advice. Thank you so much, Joy. It's really been a privilege and honour to meet you, to get to know your work, and keep on working.
Thank you.
For many of us who thinks life is over and death is end of life, Joy's story teaches something otherwise. And for many of us who think 30 years of life with family, bringing up kids, and then if life is over, Joy started her life at 50 and she discovered herself. She realized her potential. She lived the life that she dreamt of, and she inspiring others as she's moving ahead. And if for many of us who thinks age is a factor and it's too late, at the age of 81, Joy is moving ahead with her new project, Hunopku, which is a speaking platform for wellness and mental health practitioners around the world. There's always something for us to take away. Thank you.